I want to welcome all of you this morning. This is really incredible to see such an incredibly full room on our second annual Pediatric Innovation Summit. It's just thrilling to see everyone here. And the exciting part about today is that we have not just come back for a second year, but we have gone global. We've gone global because our challenges and the issues facing pediatrics and pediatric innovation are global. But so are the opportunities. Though we know that children are our future, we know that the investments by pharma, by device manufacturers, and the work that they're doing is still tiny. Pediatrics is really a small part of the overall healthcare market, and yet we know that pediatrics is again our future. We know that there are fewer hospitals like Boston Children's that are delivering specialized care. We know that patient care acuity is on the rise. And we know, and Bruce knows it better than anyone, that research funding opportunities are at risk. But when I look around at all of you, I can't help but feel confident that we are all here for one purpose. The deck is stacked very much in our favor because we are here because we have the commitment to really try and drive pediatric innovation and pediatric care further and faster than we've ever done before. John Adams once said, "There are only two creatures of value on the face of the earth, those with commitment and those who require the commitment of others." Well, there are children in every town, every city, every nation who require our commitment. With the wealth of knowledge that we have here today, with the resources and the innovative spirit that's here in this room, we are perfectly poised to really be the founders of the greatest time and the greatest period of innovation in our history. We're united by a history of success and a need to move forward faster than we've ever been able to do in the past. But whatever we have done as individuals, it's a drop in the bucket to what we can do together. We must make the best of this opportunity and find ways to work collaboratively, to build partnerships, to accelerate solutions for pediatric care from idea to research to bedside and ultimately to market. Working with the usual suspects is not enough. A creative partnership here and there is not enough. We need to build a living and breathing innovation ecosystem, a complex array of innovators sharing ideas, building off each other, challenging and defying convention, all united for the purpose of improving the life and the health and the well-being and the quality of life for children. There are three key elements I believe that are needed. One is momentum, the second one is partners, and the third one is risk. I'll begin with momentum, because the hardest part of creating the next step is getting started, to ignite, to lift off, to defy the conventional wisdom. It's all because we have to get people going, which is why I'm happy to say we're not trying to start an innovation ecosystem. We've been building one for years. How many of you were here last year? See? Okay, about half. That's great. Thank you for coming back, because I think you hopefully really took away a lot from last year. But the best part is more than half of you here are here for the first time. Because if you were here last year, you would have heard that we launched Open Pediatrics at this convention, at this summit. It is a cloud-based social learning platform designed to extend medical knowledge beyond the traditional walls of medical institutions. It connects physicians and nurses around the world so that they can take care of children remotely and do so for not just any child, but for the critically ill child. It couldn't have been done alone. We needed a partner. And who best to partner with us than IBM? We launched it a year ago, and I'm so pleased to say that we are now working with physicians and nurses in over 100 countries on 6 continents today. I'm proud to welcome Mike Roden and Dan Cerruti from IBM, who are here today. They have been partners with us for over 5 years in building Open Pediatrics. They are also our premier sponsors for today's summit. And you will hear later from them on the exciting work that not only we are doing together, but also the work that they are doing with IBM's Watson. Talk about innovation. The innovation system is really growing. We have the momentum, we have the support, and we have the partners. But are we being creative enough in choosing our partners? We need to continually ask, who does this best? Who will challenge our thinking, and who will bring resources that we do not have? We're working with all the innovators and all of the allies that we have typically worked with. Mark Watisha is also here, a longtime friend. Mark, I won't say old. And he is our national leader for our Children's Hospital Association as its president and CEO. Tomorrow, he will gather together a number of CEOs of children's hospitals from Cincinnati to Denver to Boston to Dubai. And we will talk on a panel about the challenges facing all of us and talk about how we are working together and alone to face these challenges so that we can identify solutions for children for a brighter future. But we have to be open to working with partners who are not our typical or common allies. Like Dr. Zeke Emanuel, best known to many of you as the former health special advisor to President Obama. He is now serving as vice provost for global initiatives and chair of the Department of Medical Ethics and Health Policy at the University of Pennsylvania. Dr. Emanuel will bring a unique voice to our discussion, as you will hear tomorrow. Government, policy, ethics. They aren't the first words you would think of when we think about pediatric innovation, but they play an enormous role in securing resources and influencing industry to work together with us. Damon John brings another unexpected perspective, but an equally exciting view for taking on tomorrow. At first glance, the founder of FUBU clothing line and star of ABC's Shark Tank may not be a natural partner for all of us in pediatric innovation. And yet, what is Shark Tank all about? If not providing guidance and support to inspiring innovators with new ideas who just need some help getting started. Tomorrow, Damon and a panel of venture capitalists and clinicians will provide the same opportunity to a group of pediatric innovators by convening Boston Children's very first innovation tank. We also have to be willing to step back, to take a deep breath, and to join forces with partners who are valuable because they bring a very different perspective. Later this afternoon, you'll learn about collaboration with Boston Children's and some partners who know a lot more about acceleration than any of us. Dr. Peter Waters, who is our Chief of Pediatric Orthopedic Surgery, will share with you some very exciting work that he is doing around surgical safety, working in collaboration with NASCAR and NASA. Talk about knowing about acceleration. Their partnership is already resulted in more than 100 safety initiatives that are now in place. I'll say again, the innovation ecosystem is growing. But we also need to think about the third element, and that is having the courage to take risk. We all love innovation, but we absolutely hate change. Bill Taylor knows. As founding editor of Fast Company, he helped shape innovation perspectives and perceptions of competition, innovation, and success. He'll tell you that change isn't always pretty. I'm actually not exactly what he's going to tell you about. He's up next, and I didn't read his notes. You'll also hear from Carlos Dominguez. He's built his success at Cisco on a willingness to embrace new technology and a culture that's adaptable to change. But change is difficult, and it is painful. When Dr. Pedro Del Nido, our chief of cardiovascular surgery at Boston Children's, believed there was a better way to patch a child's heart than the conventional, traditional needle and thread, he challenged the so-called best practice in cardiac surgery. And yet he didn't have to move far to find partners. In collaboration with the Brigham and Women's Hospital across the street, MIT across the river, and Gecko Biomedical, he worked together with them to identify a new solution set. With MIT's Dr. Robert Langer, who was a keynote speaker last year at our summit, they worked on developing a safe medical adhesive that cures within 5 seconds exposure to light. They challenged the notion of best practice, and they made it better. When we move beyond fear, we move to opportunity, and we move the whole ecosystem forward. And those opportunities are what I'm challenging every one of you here today to do. Don't be a passive observer. Help it grow, drive the momentum, get swept up in it. Weigh the risks, but defy them. Look ahead to the opportunities and ignite those opportunities. Listen carefully to everything you hear from all of our speakers and panel. Engage and ask questions. Also, ask whether the partner that you've been looking for is actually someone sitting next to you, someone in this room. Find them out during these next 2 days. We think that this is the greatest opportunity for all of us to come together, to find each other, and really help innovation grow and thrive. Find that partner, challenge and disrupt innovation and convention. Pursue new worlds and be willing to change everything. As we say at Boston Children's, until every child is well. Thank you and enjoy these next 2 days.